to talk about Achilles tendinosis and why we have it. This patient was on the golf course in England working on hard surfaces. Had this initially a few years back, but it went away and now it's come back. Now the question is, why is it happening? Well, here's the ugly truth about this Achilles tendinosis. It usually happens around this area. There's a couple different areas where Achilles tendinosis can happen. Tendinosis meaning chronic versus tendonitis, which is an acute issue, flare-up. Sometimes people have right here where the Achilles tendon goes into the heel bone itself, where it goes and attaches. But most of the time, the chronic tendinosis or degenerative tendinosis happens between here and here, which is exactly where this patient feels the pain. And the reason for this one is because sometimes people can have a spur in there or degenerative tendinosis right here, but a lot of times they have a spur in the Achilles tendon. This is not the case in this situation. The case in this situation is that there's blood supply coming down here, and there's blood supply coming from the bottom up, from the bone, from the Achilles itself, but mainly from the arteries down here is coming up. The arteries up here is coming down. In this area between here and here, there's a void. There's not as much blood going into that particular area. So it's coming up, coming down. Over here, unfortunately, this is the Achilles heel of your Achilles heel, and that's where basketball players, football players, even professional, up to the professional level. So it's not a matter of you being weak or you not exercising or any other reason. Professional players even have this rupture spontaneously at that site just because of the lack of blood supply in that area. But right now, even though she complained and has pain here, it's very minimal. So the prognosis is good for conservative care. Conservative care will include, at this stage, just some physical therapy as well as something called Voltaren gels, an anti-inflammatory gel that she's going to rub on her about 3 times a day to help with the swelling. Light stretching exercises that we have a video on also about how to stretch the Achilles tendon. Rest, ice, compression, and elevation, the usual RICE, R-I-C-E, can help with that too. This should resolve about anywhere from 6 to 8 weeks with proper physical therapy and the proper home care and proper stretching at home. Any other questions?
No, I'm good. Thank you.
You covered everything, right?
We did.
Okay, now we're going to do the calf stretch. Go ahead. Let's start the calf stretching. Okay, bend your front knee. You want to get the heel to the ground. The heel to the ground, and you want to stretch. Now, a little trick to this stretching strategy is point your toes in. Point your toes in when you do it. That's going to strengthen, that's going to cause you to stretch your Achilles tendon more. Now, if you point your toes out toward the outside, here's a problem. Now stretch. You see the arch is flattening. So you're really flattening out that arch when you point your toes out. You do not want to do that. You want to stretch that Achilles. So you want to go ahead and bring your toes in and stretch. Now another trick. Now you're going to notice, we're going to do another stretch. Now that's stretching out your calf muscle. Now there's 2 muscles here. There's a gastrocnemius and then there's a soleus muscle. Soleus is on the inside. Soleus does not cross the knee joint. The gastrocnemius crosses the knee joint. So basically when you're doing this stretch, you're only stretching one out of the 2 muscles. So what you want to do is now you're going to bend this knee and sit back. And sit back towards me. Right here, come back. Right there and stretch your knee. Right there, bend your knee. Right there. When you bend your knee and stretch, you're stretching out that soleus muscle. So those are the 2 different stretches that you definitely should do. Again, 3 sets of 10. Let's switch. Let's do that again. Now a lot of people do, when they stretch it the wrong way. We need to turn that foot in and stretch. Okay, very good. Okay, now we're back. This is the last and final stretch here. That's going to help you with your heel pain. Go ahead. This is a foot rocker. You go ahead and put your heel on there and you just sit back and relax, but don't fall. Stretch, 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 all the way back. This will stretch out your Achilles tendon. Again, the Achilles is attached to the plantar fascia. You want to go ahead and give a nice stretch right there. Again, you do this for about 5 or 10 minutes, alternating between legs, or do it for a few seconds, stop, do it for a few seconds, stop, and this will help stretch out your calves. Okay, here we go. This is called a night splint. This is a splint that we put on the patient. This will help with the pain, first step in the morning of getting out of a car, or first step getting out of a chair. That's usually a patient's complaint. Scientifically, it's called post-static dyskinesia, pain after you've been in a static position for a long time. Basically what happens, that plantar fascia contracts, and when you first take that first step, it gives you an ouch. When you take that first step, your foot is here, and you take the first step, ouch, you sprain that plantar fascia. So what this does, it keeps the foot in a stretch position so you don't have that acute stretch upon the first step. The goal of this is not to give you a hyper stretch, but really the goal of this is to hold your foot in about 90 degrees. So that way, when you're sleeping or resting, the foot does not drop like the other foot over there, and the plantar fascia contracts. That's where the pain comes from that first step in the morning.